Often I get asked, how many protocols will my dog need of the leaky gut protocol? And it's a really difficult question to answer, but the simplest way to look at it is, how long has your dog been sick? Has it been sick for 3 years, 5 years, 1 year? How many drugs has it has he had numerous amount of steroids, numerous amount of prednisone or anti-inflammatories or antibiotics or ketoconazole and antifungals? When you look at drug suppression, or you look at the amount of drugs, like why is that important, the amount of drugs? The way I explain to people most often is, if you think of a pipe and that water pipe has a hole in it, and you take duct tape and you duct tape the hole, it looks miraculous. It's, oh, awesome. It's not leaking anymore. It's all better. That's sort of what drugs and skin disease, or drugs and arthritis, or drugs in anything really health related does. Don't get me wrong, drugs are vital in life-threatening situations. But when it comes to chronic disease, what it actually does is that duct tape goes on, and underneath, that hole is getting bigger. You haven't soldered the hole. You haven't fixed the hole. You've just suppressed the water from coming out. And underneath, that hole is going from a pinpoint to a larger and larger and larger hole. Once the duct tape comes off, lo and behold, the hole is bigger and the water comes out with a vengeance. And that, I've heard that for 20 years at my clinic. I put him on the drugs, he looks awesome, and then the drugs stop and his disease is 10 times worse. Well, that's the reason why. It's called suppression. So when you're looking at the protocol and you're trying to deal with something that's going on a very deep core level, it could take anywhere from 1 to 7 protocols. And I know some of you are going, oh my gosh, 7 protocols, holy moly. But when you're thinking longevity in the lifetime of your dog, and you're thinking of what you actually have to do and what you're fixing a gut that has holes in it. You're trying to help the body heal the vital foundation of what the body needs in order to thrive, not just survive, but thrive. It absorbs its nutrients there. It's at least 70 to 80% of its immune system. It's an important function for the body. So you can't see it. It's not like you're healing a cut on a leg, or it's not like you're something topically that you can see instantly. It takes a while, and then once the gut is healed, then the physical symptoms that we can actually see will start to alleviate. So a lot of people say to me, well, at least my dog is 10% better or 15% better, and he's only had 1 protocol, but he's not on any drugs. So at least that's an improvement without suppressing him. So then we go, okay, try a second protocol. The second protocol happens, he's 40% better. You can keep doing that until you're at a place where your dog is actually on a roll and going towards full health. So the short answer is anywhere from 1 to 7, depending on how long the animal has been sick for, and depending on how much drug suppression that they've had. So I hope that answers your question.